Hey there, this is our Sannu Climate Health Early Warning and Response System. Um, the background for this is we believe that cholera monitoring systems are outdated and rely on self-reporting and oftentimes lag behind the reality of cholera spreading. What we've done here is set out to build a predictive system which will proactively identify areas that are high risk and deploy strategies to mitigate that risk. Um, the first thing we did to build this model was identify the relationships between several key variables and the prevalence of cholera. Those key variables are health facility access. Um, as you can see here, we mapped it out throughout Nigeria. The other layer is precipitation levels. Areas with higher precipitation tend to face higher risk of cholera, and then water access with these water point mappings. Limitation here is this water mapping data was not complete for the whole country. As you can see, there's areas of northwest and northeast Nigeria that are not mapped but surely have water points. Um, After doing that, we identified historically areas that have been high risk of cholera and have had outbreaks in the past. Um, the goal here is we can build a baseline regression relationship between these variables and cholera outbreaks. And as things change over time, as health facilities get built, and as precipitation levels get projected to be higher or lower, we can adjust the risk level for each of these regions. And once it reaches a certain threshold, trigger a alert.
Yes. So once our model has figured out these regions that are most affected, the government will see them on this map. We have 4 regions listed right now. We're also going to find certain stakeholders in the vicinity. So in this case, we have the care facilities listed out for Ebonyi, but if we wanted Oyo or Niger, Cross River, we'd have all that. Then to the government's discretion, if they deem that it's necessary, they can send out an emergency alert, an emergency warning. Um, just clicked it here, and then yeah, I just got an emergency alert with this text over here. Totally up to the government's discretion on what they want to write over here. Um, this can also come in the form of an SMS, email, etc., depending on what we want. We have a work in progress for the clinic view. So if certain clinics want to send out notifications to their patients that there's an outbreak happening to, stay home, etc., they can also do that. And yeah, that's our presentation. Thank you.